Hi everyone, this is Kishwer Munir. I am Assistant Professor at School of Integrated Social Sciences, University of Lahore. I welcome you all in another episode of SISS Faculty Conversation Series from the platform of Center for Security, Strategy and Policy Research. Please subscribe to our channel if you haven't yet. Today our topic of discussion is the COVID-19 and public perception in Pakistan, what the data tells us. In an unprecedented turn of events, the year 2020 saw the COVID-19 take over the world. Since the outbreak, the world is not the same as it was earlier. In the month of March, WHO declared the pandemic as coronavirus a global pandemic and urged the states to go for policies, strategies to protect the public from the pandemic. A pandemic like this neither differentiates between the cities, nationalities, region, countries, age, sex, religion, nor it differentiate between the public and the leader. It forces the states to go for the lockdown of localities, cities, shutting down of the industries, businesses, and educational institutions. Pakistan also went for the lockdown in the month of March, and since then there is a tug of war going on between the central and the provincial government, especially the same government, and to devise and to contain the virus. It's very important that the data-driven policy should be planned, and to data which reflects the public perception and the public attitude towards the coronavirus. And there are the two aspects of the COVID-19. One is related to the implication of the COVID-19, whether it's political, social, and economic implication, and the other is related to the fear of death by the COVID-19 or either death by the hunger, as repeatedly asserted by our Prime Minister in his various speeches. To know the public perception and attitude towards COVID-19, today we have invited Bilal Ijaz Gillani, who did his master's from SUAS in IR, and he had the hands-on experience in the field of research. He's the executive director of Gallup Pakistan, and Gallup Pakistan has been conducting the weekly tracker survey to monitor the public perception in coronavirus-related issues. The aim and objective to this tracker is to create the body of evidence for the policymakers. Thank you, Bilal, for joining us. I would request you, first of all, to share your personal experience as a researcher and why did you join the Gallup Pakistan? And also, I want you to share the survey methodology that you are using to collect the data during this lockdown period. Over to you, Bilal.
Thank you so much. It's so nice to connect with you and to have an opportunity to present the findings. Your first question, why I joined Gallup. To me, the public opinion polling is a very sacred job in a democracy because when we talk of democracy, we talk about giving representation to the people, having a government that listens to the people. Um, when it comes to listening to people in democracies, every election provides an opportunity. But what happens within the election time period? How can public will be understood during the election time period? In countries such as Pakistan, where the national and the provincial assemblies size have become such large, so for a national assembly, there are about 800,000 people who are are represented by one person. The problem becomes even more extreme, where the representatives of people have no idea what people are thinking. So public opinion in that sense to me provided a great opportunity to not only understand what the public opinion is and how a common Pakistani lives his life, her life, and what are their aspirations, what they want out of life, but also to create an instrument that can provide policymakers with an up-to-date understanding of what Pakistani pulse is, what the Pakistani political weather is, what Pakistani social weather is looking like. In terms of the weekly corona perception tracker that we've been running, So we have done about 6 waves of polling. Corona has been here for about 3 months now. So every second week we release a report. The purpose of the report was to do three things. So we wanted to understand to what extent people are knowledgeable about COVID-19, knowledge about not just the government initiatives, but knowledge about how corona is spread, how it can be avoided. Um, wanted to do a second thing, which is to look at what are people's attitude towards COVID-19. Are do they think that COVID-19 is a man-made phenomena? Do people think COVID-19 is exaggerated? Do people think that they are prone not to get COVID-19, for example? Somehow they have an immunity against it. And a third thing that we wanted to do is that what are practices that people are doing in with respect to COVID-19? So are people wearing masks? Are people social distancing? How are people coping up with the economic realities that have fallen over them? So knowledge, attitude, and practices was a framework that we kind of used, and we wanted to make sure that again, as a pollster, as a public opinion firm, we were able to connect the people with the policymakers in this crisis times, and to provide an instrument that was available to policymakers to do decision making based out of data, but also to do some sort of impact evaluation of the activities that the government was doing. So we've been, apart from the weekly tracker, we've done a program under which we reviewed the Tally School initiative. So we looked at how many people were affected by it. We've been doing a study looking at businesses, so looking at the government's interventions at the businesses level and how people are perceiving that. We've done work in the microfinance field, looking at microfinance borrowers and the government's initiatives in the microfinance related to COVID and how they are working out. So essentially, providing support to the government and policymakers, so that in this crisis times they're able to make decisions not in the dark, but are making one in the lit by data as it becomes available.
Bilal, I had read report your attitude tracker survey wave report, 4, where you have mentioned the 5 key areas. The one of them is the perception of threat from COVID-19. There is a general perception in Pakistan that the people of Pakistan are not taking it as serious, and they are considering it as a hoax. And what the data tells us, and connecting to it, do you think if the people are not taking it seriously, it's a failure on the part of the government or the media, the awareness campaign run with reference to the COVID-19, either it's run by the media or the government. So what's the data tells us? We are general. There's a perception that Pakistanis are not taking it seriously. They consider it a hoax. So what's your data?
Sure. In the beginning, when in early March, we started polling on the issue, there was a feeling that people were not aware of COVID-19. So it was an awareness lack, which was leading into people not taking precautions, and therefore not abiding by the WHO guidelines. So it was an awareness gap, which was, I mean, to some extent, an unavoidable one, because it was just the start of COVID-19. The government and other organizations were also getting their heads around it, what to do and what to solve it. So general public level awareness had just started. So there was, I mean, we thought that was all right. In the second wave, we saw that now that there is awareness. So when you ask people if you knew about COVID-19, most people would say, yes, we know about what COVID-19 is. Are you bothered by it? Do you think, are you threatened by it? Do you think this is something that can hurt you or your family? We saw that there was some rise, since the past wave, but there was not a significant rise. So a very large number of people thought, well, I haven't seen a patient that was COVID-19. So, I mean, maybe it's not in my area. Maybe it is there. I'm not saying that it's not there, but maybe it's not in my area. So my area is clean. We are basically more hygienic people. We are living in mountainous areas, so there are no people coming from outside. So lots of reasons why I am immune, and therefore I don't need to act. But we also saw that people who were aware and who were feeling that this is something of a threat, there was an inability to do precautionary measures. So when we asked, are you able to buy masks? Are you able to buy sanitizers? Are you able to follow the SOP in terms of quarantining yourself? A lot of people said that, well, we want to do it, but we are unable to because there was a shortage. So by wave two, there was awareness was complete, action was a little limited, and there was a shortage of things that people could do. And by wave three, the story had kind of changed, and that's the peak in our sense of awareness also working out. People started to take a lot of precautionary measures. So something like 70% saying they were wearing masks, they were frequently washing hands, they had been exposed to the public communication drives, and about only a third were saying that men in the family were going out to pray, for example, which kind of was a proxy for showing that people were concerned and they wanted to take that option out. From wave three onwards, we see that the government starts to give a little bit of mixed signals about it. So in the beginning, there was a tussle, but then the tussle was just in words. In effect, the lockdown had started to happen. But by wave three, which is somewhere around April, we started to see that Ramzan was about to come. So the government gave in on the Taraweeh prayers. By around the Eid time, the government started to give in on, say, the Eid prayers as well. The government started to give in on markets being open. And from there onwards, we see that in spite of people being aware of everything, their attitude towards COVID-19 became far more relaxed. They started to actually think that this was not something of a grave threat anymore to their family, and their practices started to reflect it. So in our latest round, for example, 70% of men say that they went out to pray on the Eid day. The Friday prayer, about the number that had fallen to only 3 out of 10 has now risen up to at least 6 out of 10. So another additional 3 people out of 10 are now visiting. When we say, is there lockdown in your area, most people say the lockdown is almost over in their area. So it seems it's not a static behavior that people have shown. People's behavior has changed. In To complete this, our understanding is that in the crisis times, the people are looking for leadership from the government. When the leadership was shown and there was a lockdown, there was a very large support of lockdown. Contrary to what the media was telling, that there was a very large lack of support, there was a very large support for lockdown. So in wave 2 or 3, we looked at this, and about 75% of people were in support of lockdown. This included all varieties of people, even people who were very affected by the economic downturn, they were in supporting it. So people wanted to take leadership from the government. When the government was doing it, by wave 3, things were looking good. But then from wave 3 onwards, the government started to kind of cave in on multiple things, on multiple constituencies. So the religious lobby, the economic lobby, the intellectual lobby, they started to cave in. And when the government started to shivered around its leadership, people got really confused. And our understanding, or at least my personal understanding, is that um, the currently people are very confused about what to do, and that confusion emanates from the government having a very mixed signal about it, and I mean and everything being open around them. So it's making them very hard. It's making it very hard for them to do anything because they see everyone else is out. Why should I be not out? uh, Everyone else is propagating for opening up. Why should I be not a proponent in my family discussions? Or so there is a lot of social murmur around about around these issues, and that's I mean to some extent it's to do with government not taking a leadership stand anymore.
Bilal, you mentioned about the lockdown, and the lockdown as a measure of social distancing has been implemented across the world and so as in Pakistan. So, an estimated 5 billion population across the world in one another form of the lockdown. Lockdown affected the world economy, and even the world largest countries' economies have shrunk, and they have forecasted, the IMF and the World Bank forecasted that for the third world and developing countries, this effect is going to be more devastating. So, what's your data tells us about the human suffering? It's the human suffering, and to what extent it's going to Pakistani household economies being affected by this COVID-19.
So we've looked at a couple of angles on the economy. So one in the very beginning, we looked at how many people were reporting loss of livelihood or a significant reduction of livelihood. And we saw, I mean, very alarming numbers. And I mean, in the beginning, it felt as if this was not true. So 9 out of 10 households were showing that they had almost zero income during the month of May, for example. If there were at least 10% of people who said that they had started to sell their assets because after having no income, they had went into their savings, and after having spent their savings, were now liquidating their assets to actually survive. Um, we asked a question: if you, in order to make the livings requirements being met, are you trying to now save on food, for example? And at least a quarter of the respondents mentioned that they had now started to consume less higher quality food or less amount of food because things were getting tough, and they wanted to make sure that they had enough to eat for a longer time period rather than enjoying good quality or higher amount of food. So um, we looked at the labor force survey, for example, and then from there we identified the three areas of vulnerable populations, and we saw that at least 19 million people from a total of say 55 million labor force were at extreme threat of being unemployed if the lockdown situation was to continue or was to be strengthened. And in terms of there was a Gallup International survey that we were part of, in which 19 countries participated across the globe. These included countries such as India, for example, and a few other countries which were low income or medium income like us. And Pakistan was at the top in terms of those proportion of respondents who were saying that the COVID-19 posed a grave threat to their economic livelihood. So the numbers, I mean, the numbers that are now being reported, that first time ever in 70 years, Pakistan's GDP growth rate is going to be in the negative, that across the all manufacturing, services, and agriculture, there is a significant recession. We think that these numbers are a reality, and these should not be taken just as numbers, because on the ground there are millions of households who have had no income for at least 3 months now, and they are now kind of relying on. I mean, they first relied on their savings, but then the savings, as you know, an average household Pakistani saves only 4,000 rupees a month from in savings. and those savings are then eventually spent, and no one foresaw that COVID-19 is going to strike. So people had very limited savings. So when income was lost, they started to use their savings. When savings were taken over, they started to either liquidate assets or start to ask for help from neighborhoods. And now, when the neighborhoods are exhausted and the assets are exhausted, what is going to happen? And our understanding is that that's going to create a huge base of Pakistanis who are unable to eat a diet that and these are very unprecedented times even in our checkered history. So if you are to believe in the fact that Pakistan has never had this sort of recession, um, do you see the government or at the social level uh, implementation of measures or programs that are unprecedented in Pakistani history? My personal understanding is that the reality, people have not really caught up to the reality that is about to fall, and that's where we are also lagging in terms of communication campaign of so alarming people as well as alarming philanthropists around or people with money around that this is the time that you need to jump in, not only for social good but also for your own, for your good as well. For your businesses would not be able to survive if people went into deep recession.
Bilal, that's very important. It's very important aspect of the COVID-19, the economic implication, the negative economic implication. Our Prime Minister repeatedly asserts this, that the lockdown is going to affect the lower classes, daily wages. So, what's the opinion of the? Is there any division regarding the lockdown extension of the lockdown, especially if you had any data related to that, that the people's perception towards the performance of the government, how they perceive the performance of the central government or the provincial governments, are they in favor of strict lockdown or another type of lockdown where the SOPs made by government should be followed by the people?
From the first wave, we've been monitoring the public perception by asking a question: to what extent do you agree, disagree that the federal government of Pakistan is controlling the Corona crisis situation very well? And we've seen very high numbers. So by wave three, which was in April, we saw about 82% of people agreeing with this statement, essentially saying that they thought the federal government's performance with respect to the COVID crisis at least was good. In the latest wave, that is in June, we see a significant drop. So from 82%, it's fallen to 67%. So it's still very high, considering that the federal government, composed of PTI and a few other political parties, their total vote base was not more than 40%. And here, 67% are saying that they are satisfied with the government's performance. So and it is not unprecedented in the sense that the same question was repeated in 19 other countries by Gallup International Survey. And there were other countries as well which saw very unprecedented levels of satisfaction with the government performance. For example, in India, the number when Pakistan had 82%, in India the number was 92%, despite the fact that the Modi government is very divisive and in very large segments of population, its other policies are very much confronted and opposed. There and there were many other countries. Pakistan, I think, ranked at that time as a third most popular rating for the federal government, but and there were two other countries that were doing even more. So that begs the question that in the crisis times, people are generally looking at the government for direction instead of uh, considering the federal government as a political entity. They're looking at federal government as providing a national leadership at this crisis moment. Only in extreme situations would this trust be broken so much that the numbers would go into negative, and that would be a very very alarming situation where the in the crisis times people are not taking the national leadership seriously, or they think there is a trust deficit between them. We have signs now that, I mean, from April time period, things have started to aggravate in that direction, but it's still very very high. And I mean, my message to the political leaders would be that this is no time for politics, and people are not interested in politics at this moment. For them, the survival and the economy are the two main measures. So not only the federal government or any provincial government should try to score any political marks. There are no political marks. The constituents are not giving any political marks here. So across the board, there is support for the federal government across party lines. And when it would fall across party lines. So PTI supporters would also not rate well. So in terms of the federal government and its performance, your second question on whether the support for the lockdown or other forms of SOPs has that seen any sort of segmentational differences? So we've seen across the world there are data sets to suggest that uh, the households and individuals which are operating in the modern economy and are able to, for example, work remotely, their support for lockdown situations in those constituencies or in those segments, the support is very high. Whereas among poorer people, even though they are the most at risk because they are the frontline workers, for example, despite that, they are asking for the lockdowns to be opened up. We see a not so extreme situation in Pakistan. So, but there are a few segments of the population that are more supportive of the lockdown than less, and there is income is certainly one of those indicators. So, as one climbs over the income ladder, income and education ladder, there is more support for the lockdown. So the highest support for lockdown to be reimposed, for example, in our surveys is among the undergraduate and above education cadre, as well as the top income quintile. Um, I also wanted to talk a little bit about what are the segments of the society that are essentially kind of left out of the communication campaign that the government has been running, because it to some extent we see a relationship between where the government's message was listened to and heard. There was more compliance. So in this particular case, the knowledge was actually converting into a better attitude and a better practice. But there were segments that were left out. So segments that were left out were the younger populations were are less convinced about the threat of COVID-19 rather than the older generation. So in our surveys, the 18 to 24 population seems to be the least convinced that this is a grave threat, and that they are also at a threat to be. We also see similar levels in Balochistan and KP, where mobile communication is less used, and therefore it seems that one of the key sort of message vehicles that the government was using was this ringtone message that gets played. I mean, as high as 70% of people were saying that they were listening to that and they have listened to it completely. But then that 30% that were left out were unevenly divided between KP and Balochistan in younger age groups who were less bothered to kind of listen to it. They were more likely to skip it, for example. So it is, and we've been providing these numbers to the government that in order for us to create a better and more targeted awareness. These left out segments are to be pushed into through unconventional means, And one of those unconventional means could be to essentially go door to door to do such campaigns, or to use more innovative ways of, say, for example, plays in the neighborhood to attract that. So there is some. I mean, COVID-19 has been taken up in very varied ways across the country, and it is in those varied ways or segments of populations that the policy needs to be tweaked and in an incisive way. So doing a double barrel sort of throwing of campaigns is not going to work, or double barrel ways of policy making is not going to work. We need to really segment the policies to individual capacities and awareness levels.
Bilal, you have mentioned the trust deficit. There's another important sector related to it's the health sector. So there are rumors or perception that the people are not visiting the hospital. Is there any given clue in the given survey that the people are not visiting the hospital, they are not trusting the hospitals?
So we've again, for the government, we've done some preliminary work on if I mean, so the questions that we were interested was if there was testing, for example, that was done at a community level. How likely is it that you would get tested for COVID-19, for example? And then in order to sort of make it more socially acceptable and desirable, we use the behavioral science principles. For example, we asked people if they thought their neighbor is going to get tested, for example, or if we changed the situations, if people were, if the doctor that was to do that test was not the government but a private sector doctor, or your own family doctor was testing you, for example. And we saw that about 1 in 5 people were very, or to some extent, hesitant about even getting tested. And the reasons were that people were led to believe that if COVID-19 was identified in them, they're going to be quarantined into quarantine centers. So I think that's one of those policy and campaign flaws of the federal government, for example, that in the beginning there was this talk that people with COVID-19 would be quarantined into colonies, and then there were lots and lots of videos of those quarantine centers flown, shown where people were being mistreated by the police, or people were living in very unhealthy situations. So that's one reason why people were saying that they would avoid to get tested, and we thought that that was a good proxy for these are the same people. If there was some, for example, one who was getting sick in their family, we thought that is a good proxy that these people are not going to report it to the hospitals, or even to the government, because of the repercussions of the situation. Whether for example, the death statistics are being reported accurately or not, I think that's one of those really missing areas that the government needs to look into. My own personal hunch is that may be happening, because even at the most sort of local level, there is this awareness that the people dying out of COVID are not allowed to be buried en masse, for example. And I mean, there are some deeply held views in our society about births and deaths, for example. And on that, unless we do a very, very, very large campaign using, people and opinion leaders that people hold into esteem, those myths and those sort of cultural activities cannot be stopped. And so death is certainly one of them. And I mean, we haven't asked this question yet, but I mean, my own anecdotal understanding is that a lot of people are doing this. So and a lot of people are getting infected from those hidden funerals that are happening without proper following of SOPs, with potentially people dying out of corona. So it is a trust deficit, and it's not just a trust deficit with the state. I think it's a trust deficit with the information campaign that happened. I would not blame entirely the government, because I think if you look at the international scenario as well, there is a lot of mixed information that comes up from, for example, the most sort of the central organization, WHO as well. So I mean, very recently they had this sort of information campaign which said that the non-symptomatic individuals are not virus prone, for example, or not contagious, and then they had to uh, scale it back. So one day they were saying one thing, and the other day they were saying absolutely the exact. And there is a repeat pattern across on that. So I think there are good reasons why this is called a novel coronavirus. And in this, I mean, there is some scope of consistency that the government can follow. Uh, I would say that unfortunately our government has not been able to even use that small space that was available to remain consistent. And I mean, there is. I mean, the crisis is not over. There are still at least a few months before anything would go, uh, before it goes out, and there is still time for the government to create that consistency, and for all political parties and all stakeholders in the society to sit together and potentially create a common voice against it. This is a matter of our survival, and therefore it should provide an opportunity to get together.
Bilal, the alarming rate of the spread of the COVID-19 and the severity of its outbreak has deeper concerns all over the world. So please tell us, do you see any changes in the public opinion, their attitudes and behavior since the outbreak of the COVID-19? Their living
Yeah.
lifestyles and all,
So yeah.
and especially how they are
So
passing their
yeah.
time, spending their time in during this lockdown time.
Yeah. So we asked a couple of questions around this. I mean, we asked the question. Obviously, there are. I mean, every disaster has at least some silver lining in it, and what do people think is the silver lining in this one? And interestingly, all across the world in the Gallup International Surveys, a few things kind of resonate as something of a benefit out of the lockdown situation. So when the lockdowns were more significant, a lot of people spontaneously mentioned that and I mean, unconnected to social media or anything. They were mentioning that the environment around them had become much more cleaner. Uh, so we could listen to to birds singing, or the sky looks blue again. There is less litter around. At a lifestyle level, there was a greater realization that, or at least some time to retrospectively view on this, that the modernity and its lifestyle changes had at least some negative effects. And when the modern life had come to a standstill, even the common man was able to kind of identify issues that had become much better. The second one that people often uh, mention are people's ability to spend time with family. So a lot of I mean, children are at home continuously. Men who work out are at home. Women who work out are at home. People mention being able to spend time with the elderly far more. People, I think 80% of the people mentioned that they thought that this was a blessing in disguise, that they are able to connect with their family members. So at the same time, I think a third one that people mention is that they have started to pray more. It's some sort of spiritual reconnection with with the world and the higher order. Um, that's all the good side of it. We also explored how behaviorally in terms of lifestyle, how for example the gender side of the argument has changed. So very large numbers, I think, I mean more than 50% agree with the statement that under the COVID times, the burden on the women in the family has significantly increased. Um, there is slight bit of, I think there's a 10 to 12% difference between men and women, where women are more appreciative of this fact or the statement and men are less appreciative. But then still more than 50% of men are also agreeing to the fact that this situation has created a higher burden for women. We also asked the question because I mean, literature from across the world suggests that with abusive relationships, men's increased presence at home is creating domestic abuse. So about a quarter of the population also reports in the sense that they say that they agree with the fact that the COVID situation has potentially created a situation in which domestic abuse may be happening more. Um, so these are some of the sort of the behavioral changes. If we ask a question across the world, if they thought COVID-19 is going to be transformational in terms of the new world order, is this going to create more friction between the world powers, for example? So apart from their own homes and how it's changing, is the world around them going to change drastically? And on that, about 50% think that the confrontation between the world powers is going to get more, and about a quarter are think that this is not going to be so, and a quarter are very undecided about it. So at least at the popular level, there is some conception that the COVID-19 is a global phenomena. It's going to have far-reaching implications. How they're going to pan out is something that people are still a little unsure about.
Thank you so much, Bilal. Lastly, I would want you to say about something about the role of data in the policy making, especially in this current situation and current crisis. Do you see that in future the government will going to use the data and the evidence for the policy making in Pakistan?
So I, I think there are a few things that I wanted to sort of say out in the beginning. I think, unlike, I mean, we being a data creator and a data user for 4 decades, we think that um, it is a little unfair to say that there is less data available in Pakistan. So I think over the past many decades, we've sorted out the data availability issue in a very significant way. There are still, I mean, some things that we would rather have, but there is data available. So if you look at Pakistan Bureau of Statistics, which kind of is the central body for creating data, every 2 years they're doing a very, very large scale PSLM highest survey that asks me at least a few hundred variables about people, and that's available not only at the provincial level but at the divisional district level representative data. There are, if you look at the latest budget, for example, the 7 trillion budget that the government presented, there are volumes of data that are available online publicly that provide information at the minutest level. So where I'm sitting, there is a government school right in front of me, and I looked up and I knew how many people employed in this government school, what is their salary bill going to be like in the coming year, how much money are they going to spend on transportation, for example, how much money are they going to spend on furniture. There are 500 schools like these in the federal territory. For each one of them, there is the data that is being made out. So it's less to do with data availability. It's a lot to do with creating awareness or for the usability or the benefit of using data, and in which, I mean, organizations like us need to put in their share. Universities like yourself need to put in their share to create a generation of researchers that are looking at things from a data science perspective, for example. In the COVID-19, I think there are the government did try its best to be more scientific about it. So if you look at the COVID-19 dashboard that the government created, it's been updated on a daily basis. Fairly detailed information is available there. If you look at so from the health data perspective, given Pakistan's challenges, for example, I mean, if you look at the birth and the death data, so only if you look at mix, for example, it states that only 4 out of 10 births in Pakistan are recorded. So we still have data lags, and the government did its best to use policy making within that data lag. I think it's apart from the data lags, there is also a greater need to come up with a framework how data is converted into policy. So that's one missing area. So data is only good to the extent that it is implementable. And we saw that data was misused, for example, or misconstrued on many fronts. Essentially, policy making using data for their own good rather than creating a national consensus on it. So it's those areas that need to get fixed. I think the government did try its best. For example, if you look at the smart lockdown and the smart sampling methodology. So if you follow the case of Lahore, for example, where the government did Lahore level PCR testing, and then reached the conclusion that about 600,000 people were already infected just in Lahore itself. And when those statistics were presented, so it was the government who took that initiative. It was the government who implemented that initiative of doing a Lahore level study, so that जैसे उर्दू में कहते हैं दूध का दूध पानी का पानी नजर आ जाए कि किस हद तक फैली हुई है. But then it was the government who also shot down the report. So when the results were presented in the cabinet, they said it's going to be a political suicide to claim that in Lahore alone there are 600,000 people who have already been infected and are currently maybe asymptomatic. So I'd say it's I mean, we've come away from not having data. We have a lot of data. The government is also liking to create such data, but the bravery to use the data for actual policy is something that's missing, and it is that front where that brave activity needs to happen. That when you're guided by science, you have to be also brave enough to use that science to implement. And I think that's where we need to sort of put in more effort.
Thank you, Bilal, for sharing your extensive data with us, and we'd like to have you again on our session. It's a pleasure to have you. Thank you so
Thank you
much
so much.
again, and thank you, guys, for watching us. Stay home, stay safe, and take care. Thank you, Bilal.
Thank you. Thank you. Have a good day. Assalamu alaikum.
Al Islam.